Yeah, so in depression, can it be mild, moderate, or severe? That's a little bit subjective when we classify this. So depending on the severity of the symptoms, the clinician may decide to say, well, you're going through depression, that is mild. Usually when the depression is mild, it's okay to just offer self-help or reading or doing physical activity. Sometimes if the patient chooses, we can offer psychotherapy as well for mild depression as well. Or we can offer psychopharmacology in some cases because sometimes people prefer to rely more on psychopharmacological agents. And then we do this kind of like subjective classification based on the interview that we do with the patient. So we do an interview with the patient, and also we come to a diagnosis with the patient's participation as well. Based on this psychiatric interview, we try also to get as much collateral information as we can, and then we define the severity of the symptoms, whether they are moderate, whether they are impairing the person's functionings of daily activities of daily living more, and in more severe depression, the person can have actually more impairment of the activities of daily living. And also in depression, we have many forms of depression, like I said. You mentioned earlier, like what's the difference between depression and grief. So typically in grief, you have lost a loved one, and you have depressive symptoms. So any person who has lost a loved one, I think most of us have lost a loved one, we have experienced depressive symptoms. That would be more, you can make a diagnosis of grief. Nonetheless, more recently, psychiatrists have chosen, in order to see patients, have chosen that it's okay to diagnose a person with depression if they're experiencing grief symptoms for a period of 2 weeks. Sometimes we use other diagnoses, such as adjustment disorder, where the person starts having depressive symptoms after they have like an acute loss of a job or a disappointment from any situation in life, or they are coping with any kind of disappointment that they can experience in life. But after 2 weeks, the DSM, which is the classification of diagnosis in mental diseases that we use in psychiatry, we call it DSM, allow us to make a diagnosis of depression. This is a more recent change that happened in the DSM. And in depression, there are other forms of depression as well. Like somebody can have depression with melancholic features, which means that the person can have depression, but they have like severe difficulty enjoying things, and their mood is not reactive. So you can tell them the best joke in their lives, and they won't be able to find it funny. And also you can have psychomotor retardation, which means like you start moving more slowly. So those are what we call melancholic features. This comes from the Greeks. So we used to call it like melancholia, like black bile. So it's like a Greek term for melancholia, melancholic features, which are these features that the Greeks in Hippocratic medicine would see melancholia. So when you say that a person has depression with melancholy features, you're saying depression with black bile or with excessive black bile. It's like the Greek term for it. And then you have catatonic features in which the person starts having immobility, an ability to move, mutism, and they are completely disconnected. They can become completely disconnected from their surroundings and their environments. You have other forms of depression, such as atypical depression, which a person would eat more or sleep more than usual, as opposed to the typical symptoms. Or they have like interpersonal rejection problems, like they feel that they have difficulty coping with rejection by other people. So those are kind of like different subtypes of depression that we can see also. Psychiatrists usually may see which type you may fit. You don't fit any of these subtypes, you can just be diagnosed with major depressive disorder or depression, as we call it.